My infectious disease presentation, I chose the protozoan infections of giardiasis and amoebic dysenteric. So giardiasis affects the digestive system, specifically the small intestine, and these are the two forms it takes, the trophozoite and the cyst, which I will get more into later. Introduction and etiology. Giardia infections are caused by the protozoan parasite Giardia duodenalis. Infection occurs through fecal-oral transmission, and then transmission of this happens through the ingestion of cysts. Once they have gone through the digestive system, they become trophozoites, which we'll get more into later, and that attaches to the intestines of people and animals and disrupts the normal digestive process. It exists in two forms, the cyst and trophozoite. The cyst is protected by its outer shell. This outer shell allows it to survive outside the body for weeks to months and also helps protect it from being killed by chlorine, disinfectants, or any other outside factor, while the trophozoite is the active disease-causing form in the intestines. So the life cycle of Giardia duodenalis consists of two stages, the cyst and the trophozoite. The cyst exists outside the body and is swallowed, and then the cyst passes through your stomach, and then excitation occurs. This is then when it becomes the trophozoite, and then the trophozoite reaches the small intestine and begins to replicate. Then once it's there, you can see through the 8 flagella, they provide motility. In this diagram, it shows the 8 flagella, or the 4 pairs of it. And then it has a ventral disc, which is also seen in this diagram. And this is what attaches to the intestinal wall. Here's where it gains nutrients and interferes with the host nutrient absorption. And then it absorbs fats, carbohydrates, as well as other nutrients. And then they don't have an intracellular stage, meaning they live freely in the gut lumen and absorb nutrients from the host digestive process. And then before the parasite passes in the stool, then once again it goes back into its cyst form. That way it is able to survive. But it can they also pass trophozoites, but then once they are passed, they no longer are surviving. And then virulence factors. You have the ventral adhesion disc proteins. These are crucial for the parasite's attachment to the intestinal epithelium. Then you have surface lectins. These molecules help the parasite adhere to the host cell and mediate interactions with the host intestinal lining. The variant-specific surface proteins, or VSPs, are highly variable proteins on the parasite surface that allow it to evade the human's immune system by constantly changing their surface antigens. And then cysteine proteases. These enzymes degrade host proteins, including mucin, tight junction proteins, and immunoglobulins, contributing to the parasite's ability to colonize the intestines and further evade the immune response. Disease description. This disease mainly affects the small intestine. It damages the intestinal lining, impairs nutrients and fat absorption. Some people with Giardia never end up actually developing any symptoms, but for those that do, the incubation period is usually 1 to 3 weeks before you start seeing symptoms. And then symptoms include watery, sometimes foul-smelling diarrhea, fatigue, stomach cramps and bloating, gas, nausea, and weight loss. And then signs and symptoms can last 2 to 6 weeks, and then if not treated correctly or not all of it is passed, it can keep reoccurring. The prognosis with this disease is usually pretty good. Giardia infections usually clear up on their own within a few weeks or with prevention of different medications. But prevention is your best defense. Complications happen most often in children and the immunocompromised. In children, if it's chronic, it can lead to malnutrition or it can inhibit growth. And then living with the disease can be physically and mentally draining while experiencing symptoms, as you have diarrhea, bloating. It can be hard to go about your day-to-day life normally. Transmission. Um, Giardia spreads easily. It only takes a few of the like ingestion of the cysts to become sick or get infected. And then it is found in the poop of people or animals who are infected. So anything that gets contaminated by human or animal poop can potentially spread the germs. It can spread from one person to another or through water, food sources, objects, like having close contact with somebody who's sick, swallowing contaminated water, contact with feces during sex, or picking up or swallowing anything that has giardiasis on it. And then it affects 2% of adults and 6 to 8% of the children in developed countries. Treatment. Giardiasis usually clears up within a few weeks of symptoms. Several different drugs can be prescribed for severe symptoms, as seen here. And then prevention. There's no drug or vaccine that can prevent giardiasis. It's just important to wash your hands, avoid drinking untreated water, wash produce, try not to swallow outdoor water, so like swimming pools, lakes, rivers, and then to practice safer sex. Dysentery or amoebiasis. It's the infection of the intestines. And then here in this picture is a trichome stain of the parasite Entomoeba histolytica and its trophozoite form. And introduction and etiology. Amoebiasis is caused by the protozoan parasite Entomoeba histolytica. It's found worldwide, especially in areas with poor sanitation or tropical areas. And then it exists, once again, just like with Giardia, in two forms. The cyst form, which survives in the environment, and then the trophozoite form, which causes tissue damage in the human intestine after ingestion. And then here in this diagram, you can see what the two stages look like. It's the trophozoite state and the cyst state. Pathogenesis. It starts with the ingestion of the cyst through contaminated food or water. And that is ingested in the cyst form. Once it passes through the intestinal tract, the cyst wall is digested and the trophozoite is released. Here, it is able to multiply in the epithelial cells of the wall of the large intestine, or it can remain in the lumen. And then the virulence factors. Trophozoites adhere to the colonic epithelium using specific lactins. Here they just secrete enzymes like cysteine proteases and amoebophores, and then these destroy the host cells and can help invade intestinal wall. Then this triggers an inflammatory response with the release of cytokines and other inflammatory mediators and attracts neutrophils and macrophages. And then this can lead to tissue damage and then leads to symptoms like bloody diarrhea. And then it can also cause extraintestinal disease. And then this is just due to the trophozoites entering the bloodstream and then being carried to other parts of the body. You can see here in this diagram how this can happen. So matured cysts are ingested, and it can normally go through the digestive system and then eventually be passed in cyst form. Or as you can see in C, it can enter the bloodstream and then go to places like the liver, lungs, and the brain. And then you can see here in this picture, it's amoebiasis, and it's caused by the parasite Entomoeba histolytica, seen in this magnified image. But disease description, so it primarily infects the large intestine, but it can also involve the liver, as well as the colon wall. It can live in the large intestine without causing damage, but in some cases, after invading the colon wall, it could cause colitis, acute dysentery, or long-term or also chronic diarrhea. Common symptoms include to be bloody diarrhea, abdominal cramps and pain, fever and chills, weight loss and fatigue. And then it can cause liver abscesses if it's able to travel through the liver from the bloodstream. And then this symptom is usually tenderness and pain over the area of the liver. And then the disease has the very rare possibility of spreading to the lungs, brain, or other organs. Um, and then it can cause amoebic liver abscesses, which is the most common form of extraintestinal amoebiasis. And then incubation period can last 1 to 4 weeks after exposure before symptoms usually start. It begins as mild gastrointestinal discomfort. From there, progresses to severe colitis or extraintestinal complications. The prognosis is usually pretty good. It can last a couple of weeks with not everybody experiencing symptoms. But living with the disease can be kind of hard just because it causes gastrointestinal distress, dehydration, weakness. If it continues from there, it can cause things like malnutrition, and it's just an uncomfortable way to live while you do have it. And then complications include liver abscesses, side effects from the medications that are being taken, and then chronic infection, which can lead to long-term digestive issues. Transmission. This condition occurs worldwide, especially in tropical areas or areas with poor sanitation. And then it usually spreads through the fecal-oral route. And you have a higher risk if you engage in anal sex, live with other people in poor sanitary conditions, travel to places with poor sanitation, swallow contaminated food if you're not washing it properly, or water if you're not properly disinfecting everything, or if you put something in your mouth or swallow something that is unsanitary. Treatments. Treatments usually include antibiotics. Whatever's described depends on whether you're experiencing symptoms or not. One can be taken if there's no symptoms, but typically if you are experiencing symptoms, it'll be followed up by a second antibiotic. And then after antibiotic treatments, the stool will continue to be tested to make sure you have been completely cleared of the infection. And then prevention is the best way to avoid this because there are currently no vaccines available. So it's just important to be careful about what you eat and drink, especially when traveling to areas with poor sanitation. And then common preventative methods are boiling or filtering water in areas of poor sanitation, practicing good hand hygiene, especially before eating, wash produce thoroughly and avoid uncooked foods and street food in high-risk areas. And then references and sources.